Good morning, Africa. Enokwana, Ekaro, and please forgive me if I haven't said that right. Lastly, Namaste from India. I'm Dr. Ratna Devi, and I'm the chair of the International Alliance of Patient Organizations, or IAPO, as you know it. It is my absolute pleasure and delight to be addressing you today on day one of the two-day virtual Congress for the Africa region. I welcome all delegates and speakers warmly and wish you 2 wonderful days of discussion and dialogue. IAPO is the only cross-disease patient alliance that is led by patients and patient leaders. We completed 21 years in the year 2020 and are now in our 22nd year. We have a rich and long legacy that we are very proud of in patient empowerment and engagement. IAPO has over 300 plus member organizations from 70 countries representing 52 disease areas. We are a non-state actor in official relationship with the WHO and work closely with WHO on various issues like NCDs, patient safety, and rare diseases. Africa represents nearly 17% of the world population, yet very often the voice of patients and patient groups is not heard enough at important meetings. IAPO believes that to bring a transformation in how healthcare is delivered and received, patients and patient groups should be at the center of healthcare, not only in the world, but more importantly in the Africa region. Our mission at IAPO is to help build patient-centered healthcare throughout the Africa region. In the past, we have had several regional workshops and meetings in Africa. In fact, Africa gave us a Patient Solidarity Day that has now become a global movement with thousands of patients joining together to show solidarity and unity. A Pan-African event that brings patients and patients groups from across the region was timely, as Africa, like every other region, has struggled with COVID-19, vaccinations, and several other healthcare issues. It is an honor and pleasure to introduce my 2 board members from the Africa region, Bessie Bright and Elos Lodzeni, who have been leading the whole initiative from the front. They have spent long hours working on the program, reaching out to speakers and delegates and spreading the word. On behalf of the board, we would like to express our heartfelt thanks and gratitude to them. A short introduction of both my board members. Bessie Bright is a consultant clinical pharmacist, lecturer, and public health manager. She is the first vice chairman and CEO of Live Well Initiative, or LWI, a self-sustaining not-for-profit healthcare organization which has impacted almost 2 million Nigerian patients. Bessie is very passionate about patient care and advocacy. She is the Deputy National Coordinator of the National Hepatitis Coalition in Nigeria and a proud board member of IAPO. Elos is a health rights, social justice, and governance advocate, as well as a patient for patient safety champion with an enormous passion on health matters. He is a patron and founder trustee of Patient and Community Welfare Foundation of Malawi, the only cross-disease patient movement in Malawi, which articulates and amplifies the patient voice and drives the crusade for patient-centered healthcare in Malawi. He is also our board treasurer. I'd like to hand over to Elos to take the proceedings forward and declare the Congress officially open. I wish you the very best. Thank you.
Good morning, afternoon, and evening, depending on which side of the continent you are. First and foremost, let me welcome our guest of honor, the rep from Africa CCDC, Dr. Ahmad Ogwell. Let me also welcome the Minister of Health from Egypt, Dr. Zayed, the IAPO board chair, Dr. Ratna Devi, and all board members, IAPO CEO and staff, all panelists and participants. Today, we are witnessing a historic and memorable day for IAPO and Africa region. This is historic due to the fact that since the setting up of IAPO 8 years ago, to be precise, in 2013, this is the first Congress which IAPO has hosted for Africa. The Congress provides an important sustainable launchpad in the amplification of the patient voice to greater heights as we strive to bring back better health systems and attain UHC. Several people have contributed towards the successful organization of this event. Kawadip is the CEO and his team who have worked 24/7, the advisory committee, and all IAPO board members. I wish to extend my special gratitude for your superior efforts, which have made us reach this far. Distinguished guests, please be informed that IAPO has come to stay in Africa. There are some plans and activities that reinforces this fact. IAPO plans to shape law and policy by engaging with WHO-AFRO in implementation of the Global Safety Patient Action Plan, which has just been approved, 2021 to 2030. We are exploring how patient advocates can support member states in the implementation of the plan. One avenue is working through the recently launched IAPO Patient for Patient Safety Observatory, details of which will be elaborated in the course of the sessions. In pursuit to building back better healthcare, we are working towards establishing a Pan-African Patient Alliance, which will collaborate with all major stakeholders to ensure that patient-centered healthcare and UHC is a reality. In collaboration with AU, we have advocated for the ratification and operationalization of the Africa Medicine Agency Treaty, through the AMA Treaty Alliance. Lastly, we have plans to collaborate with WHO Global Diabetes Compact, NCD, rare diseases, and mental health in Africa. We invite you to explore further details of our plans through our strategic document on the IAPO website. With these remarks, I wish you all a successful and fruitful Congress. Long live IAPO. Thank you.